Hello everyone, welcome to my channel Dr.shil's Physio Victory. Today we'll discuss the fourth part of the GSSSB 2025 questions. Let's start. Today's first question is, what is a major limitation of lung expansion therapy using an incentive spirometry? Option 1, it mobilizes secretions. Option 2, it effectively reduces atelectasis. Option 3, it can improve oxygenation. Option 4, it requires active patient cooperation and effort. Here the correct answer is option 4, it requires active patient cooperation and effort. So it is the limitation of incentive spirometry, because for unconscious and drowsy patient we cannot use incentive spirometry. Next, come to question number 77. Which auscultatory finding is most indicative of left-sided heart failure? Option 1, reduced breath sounds at the lung apex. Option 2, pleural friction rub. Option 3, S3 gallop. And option 4, high-pitched wheeze during expiratory phase. Here the correct answer is option 3, S3 gallop. This is the image. Left side, normal condition S3 is very small, but in abnormal conditions S3 is similar to the S2. So this is called the S3 gallop. Now we'll understand reduced breath sound at lung apex, more suggestive of pneumothorax. Pleural rub is more suggestive of pleuritis, and high pitch wheeze is COPD. Next, come to question number 78. Which of the following is best described as contused, con, contused lacerated wound? Option 1, a wound caused by blunt trauma with irregular torn edges. Option 2, a superficial abrasion of the skin. Option 3, a clear cut wound caused by a sharp object. Option 4, a a puncture wound caused by a pointed object. Here the correct answer is option 1, a wound caused by a blunt trauma with irregular torn edges. So this is the image of blunt injury. Next, come to question number 79. Which is the most common site of fracture in the cervical spine? Option 1, C2 vertebra. Option 2, C1 vertebra. Option 3, C5, C6 level. And option 4, C7 vertebra. Here, the correct answer is option 3, C5, C6 level. The C5, C6 level is the most commonly injured region of the cervical spine, because it's a highly mobile segment of the cervical spine, experiences maximum flexion and extension stress. So it is frequently involved in the road traffic accident and whiplash injuries. C2 is for hangman's fracture. C1 is for high energy trauma. and C7 injured occasionally. Next, come to the question number 80. Which incision is made along the midline of the abdomen? Option 1, McBurney's incision. Option 2, Kocher's incision. Option 3, midline vertical incision. And option 4, Penstyle incision. Here, the correct answer is option 3, midline vertical incision. I have made a different video for incisions of the abdomen, and most important incisions I have described in this video. If you haven't seen the video yet, go to the playlist and watch the video. It will help you in your upcoming exams. Next, come to the question number 81. Myofascial release primarily targets which structure? Option 1, bone marrow. Option 2, articular cartilage. Option 3, nerve roots. Option 4, fascia and connective tissue. Here, the correct answer is fascia and connective tissue. Myofascial release is a manual therapy technique used to relieve the pain and restore movement by addressing restriction in the fascia. Next question. In electrotherapy, which type of electrical current is commonly used to strengthen weak muscles? Option 1, Faraday current. Option 2, direct current. Option 3, microwave radiation. And option 4, ultrasound waves. Here, the correct answer is option 1, Faraday current. Faraday current is an interrupted alternating current produces tetanic muscle contraction. So it is primarily used for innervated but weak muscles. Next, come to question number 83. Which option best describes the primary goal of functional re-education in physiotherapy? Option 1, limiting patient activity to prevent fatigue. Option 2, focusing only on stretching and flexibility. Option 3, performing exercises only to strengthen muscles. Option 4, retraining movements required for activities of daily living. Here the correct answer is option 4, retraining movements required for activities of daily living. Next, come to question number 84. For rapid correction of coagulopathy during massive transfusion, which blood product is preferred? Option 1, cryoprecipitate. Option 2, fresh frozen plasma. Option 3, platelet concentrate. And option 4, packed red blood cell. Here the correct answer is option 2, fresh frozen plasma. In massive blood transfusion, patients rapidly lose coagulation factors due to hemorrhage, hemodilation, and consumption of clotting factors. In fresh frozen plasma, it contains all clotting factors: clotting factor 1, clotting factor 2, clotting factor 5, clotting factor 6, clotting factor 7, clotting factor 7 and 8, clotting factor 9, clotting factor 10, and clotting factor 12. The core component of massive blood transfusion protocol, there is ratio is PRBC is to plasma is to platelets 1 is to 1 is to 1. Next, come to question number 85. A characteristic spinal manifestation of ankylosing spondylitis is option 1, spondylolisthesis, option 2, bumbospine, option 3, hyperlordosis, and option 4, kyphoscoliosis. Here the correct answer is option 2, bumbospine. This is the image of Bombospine. You cannot differentiate the intervertebral disc over here because it start fusing. Next, come to question number 86. Which ovarian tumor is most commonly found in young women and is usually benign? Option 1, dysgerminoma. Option 2, serous cystadenoma. Option 3, granulosa cell tumor. Option 4, mature cystic teratoma. Here, the correct answer is option 4, mature cystic teratoma. It is the most common ovarian tumor in young women from age 20 to 40 years. Arises from the germ cell, and in 95% cases it is benign. Dysgerminoma is a malignant germ cell tumor.
Serous cystadenoma is benign epithelial tumor, more common in the middle-aged woman, and granulosa cell tumor is sex cord stromal tumor.
Next question is question number 87. During the cardiac cycle, the second heart sound is produced due to which event? Option 1, opening of semilunar valves at the beginning of ejection. Option 2, closure of atrioventricular valves at the beginning of the systole. Option 3, opening of the atrioventricular valves at the beginning of the ventricular filling. And option 4, closure of the semilunar valves at the beginning of the diastole. Here, the correct answer is option 4, closure of the semilunar valve at the beginning of the diastole. Closing of the atrioventricular valves at the beginning of the systole is basically the S1 sound, and opening of atrioventricular valves during ventricular at beginning of ventricular filling is S3. It's not a normal sound, it's a pathological sound. Pathological state. So this is the image in left section. This is first heart sound, which is called love due to the closure of the atrioventricular valve. And in the right section there is second heart sound, which is dub due to the closure of the semilunar valve. Next question, question number 88. Which clinical feature distinguishes a venous ulcer from other type of ulcers? Option 1, irregular margins with granulation tissue and hemosiderin deposition. Option 2, clean margins with a non-healing sinus tract. Option 3, uh, undermined edges with thin bluish skin. Option 4, punched out margins with a pale base over the toes and foots. Here the correct answer is option 1, irregular margins with granulation tissue and hemosiderin deposition. Clear margins with non-healing sinus ulcer generally seen in the osteomyelitic ulcer. underbind ages with thin blue skin, generally seen in the tubercular ulcer, and punched out margins with pale base over the toes and foot, seen in the ischemic ulcer. This is the image of the venous ulcer. This is this blackish color are hemosiderin deposition, which is the byproduct of breakdown of RBC. Next, come to question number 89. Which hormone is produced by the anterior pituitary gland and directly stimulates the adrenal cortex to release cortisol? Option 1, thyroid stimulating hormone. Option 2, growth hormone. Option 3, prolactin. And option 4, adrenocorticotropic hormone. Here, the correct answer is option 4, adrenocorticotropic hormone, which secretes by the anterior pituitary and acts directly on the adrenal cortex to stimulate synthesis and release of cortisol. TSH hormone stimulates thyroid gland to produce T3 and T4. Growth hormone promotes metabolism and promotes growth on direct action of the adrenal cortex. So this is the image of anterior pituitary hormones: prolactin, thyroid stimulating hormone, growth hormone, follicle stimulating hormone, luteinizing hormone, and adrenocorticotropic hormone. Next, come to the question number 90. During examination, which is the most indicative clinical sign of chronic pulmonary dysfunction? Option 1, pronounced lumbar lordosis. Option 2, barrel-shaped chest with decreased breath sounds. Option 3, decreased deep tendon reflexes. Option 4, tenderness over the deltoid muscle due to strain. Here the correct answer is option 2, barrel-shaped chest with decreased breath sound. Next question. In expiratory muscle strengthening, which exercise technique is commonly prescribed? Option 1, blowing against a resistive device such as PAPE device. Option 2, strengthening neck flexors in the supine position. Option 3, unresisted wide breathing. Option 4, breath holding at maximal inspiration. Here the correct answer is option 1, blowing against a resistive device such as PAPE device. So this is an image of PAPE device frequently used in the hospital setups. PAPE device is blowing against resistance, which increases the expiratory load, produces active contraction of the expiratory muscles, which improves expiratory muscle strength, cough effectiveness, and airway clearance. Next, come to question number 92. Which exercise helps in increase chest expansion and improve breathing pattern in patients with a slouched or forward flexed posture? Option 1, pelvic tilting in prone lying. Option 2, scapular retraction combined with deep breathing. Option 3, prolonged supine rest without movement. Option 4, shoulder circles with shallow breathing. Here the correct answer is option 2, scapular retraction with combined with deep breathing. Patients with slouch posture or forward headed posture have reduced thoracic mobility, decreased chest expansion, and restrictive breathing pattern. Scapular retraction opens the chest and corrects rounded shoulder, encourages thoracic expansion. Next come to question number 93. While treating lower limb fractures, which key precaution should be taken? Option 1, ignore signs of swelling or numbness. Option 2, monitor for neurovascular compromise, deep vein thrombosis, and pain. Option 3, encourage early full weight bearing without medical clearance. Option 4, forcefully stretch the immobilized limb. So, clear answer is option 2, monitor for neurovascular compromise, deep vein thrombosis, and pain. So, these are the most important neurovascular assessment. You have to remember the 6P: pain, poikilothermy, paresthesia, paralysis, pulselessness, and pallor. So you can take a screenshot of this and read this carefully. Next, come to question number 94. After stroke, which gait deviation is most characteristic of a hemiplegic gait? Option 1, circumduction of the affected lower limb during the swing phase. Option 2, isolated drop foot without compensatory movements. Option 3, excessive knee flexion during stance. And option 4, normal step length with reduced cadence. Here, the correct answer is option 1, circumduction of the affected lower limb during the swing phase. In hemiplegic gait, following stroke, the affected lower limb typically shows circumduction during swing phase. The leg is kept extended and stiff due to spasticity of extensors and weak hip and knee flexor, and also reduce ankle dorsiflexion. Next, come to question number 95. If a patient experiences intolerance to cold and develop numbness during application, what should you suspect? Option 1, optical optimal therapeutic response to cryotherapy. Option 2, normal expected adaptation. Option 3, possible sensory nerve involvement. The treatment is contraindicated. Option 4, ability to tolerate deep cold therapy. Here, the clear answer is option 3, possible sensory involvement, and treatment is contraindicated. Next, come to question number 96. In kinesiology, biomechanics uses mechanical principle to study option 1, changes in the weather, option 2, growth of plants, option 3, human body and movement, option 4, computer program. The clear answer is option 3, human body and movement. Next, come to the question number 97. Which patient needs passive range of motion exercises for the most? Option 1, a patient who regularly perform aerobic exercise. Option 2, a patient actively engaged in resistance training. Option 3, a patient with a mild ankle sprain who can bear weight. Option 4, a post-stroke patient with complete paralysis of the upper limb. Here, the correct answer is option 4, a post-stroke patient with complete paralysis of the upper limb. Next, come to question number 98. The angle of pull of a muscle refers to option 1, the angle formed between the muscle's line of pull and the long axis of the bone. Option 2, the distance between two bones during movements. Option 3, the amount of energy a muscle can store. The option 4, the direction of blood flow within a muscle. Here, the clear answer is option 1, the angle formed between the muscles line of pull and the long axis of the bone. Here, with this image, you can understand the angle of pull. This angle is called the angle of pull. Here is the direction. This is the direction of muscle contraction. This is a long axis of the bone. Next, come to the 99th question. Human posture is mainly influenced by two body system. Option which two body system? Option 1 nervous system endocrine system. Option 2 respiratory system excretory system. Option 3 skeletal system and muscular system. And option 4 digestive system and circulatory system. The clear answer is option 3 skeletal system and the muscular system. Next come to the question number 100. Which physical characteristic distinguishes advanced electrotherapy modalities like laser and ultraviolet from conventional electrical stimulation? Option 1 better penetration through thick muscle tissue. Option 2 use of electromagnetic radiation instead of direct electrical current. Option 3 selective activation of motor neurons without sensor involvement. And option 4 dependence on alternating current frequency for muscle contraction. Here the correct answer is option 2 use of electromagnetic radiation instead of direct electrical current. Thank you everyone for watching this video. Please do like and subscribe to my channel. If you found the video is helpful, then share with your friends and comment in the comment box which topic you want to learn in the next video.